When you do get up, do you have a routine? Do you have to do certain things certain ways throughout your day? Things have to be a certain place. What about your kids? How do you know if routine is obsessive, compulsive? How do you determine that? We've talked about OSD before here with Dr. John Braccio, Regional Psychological Services. We're going to delve into it here a little bit further this morning with Dr. John Braccio, Dr. John B. on the web, and it's what I call "What's Up, Doc?" Hey, Doc, what's up?
Well, listen, good to talk to you, Mike. And one of the things we tend not to think about that much is with children with OCD, okay, with obsessive-compulsive disorder. We're talking about any given time, probably estimated 500,000 have it, and 1 to 3% overall will have it at one time or another in terms of in their youth. So we're talking about really large numbers here. Maybe not one on every small group, but you're going to run into a large number of persons with this young persons. And obsessive-compulsive disorder, as we've talked before, really can be a torturous psychological condition for even the brightest and most talented of persons. It's the cycle of obsessive thoughts seemingly only reduced by compulsive behaviors in a never-ending cycle. Now, if this isn't controlled, it can greatly disrupt the life of the person with this condition. It can be particularly devastating for children and adolescents who really don't understand what it is and believe it's normal, and that they can overcome obsessive thoughts by believing that compulsive behaviors will satisfy or eliminate them. And this is a self-defeating thing because it doesn't work that way. And unfortunately, OCD can alter the personality of the person. They'll get very angry and have high anxiety if you're trying to tell them, hey, quit doing that. That's a waste of time to be washing your hands all the time or putting everything in the exact way. So it's a hard thing to overcome. And it sounds simple to, well, it can't be that difficult. Well, it really is. It really overwhelms children. It can overwhelm parents. And then common obsessive thoughts and resulting compulsions would include like dirt, lead to constant washing of hands, constant reinforcement that what they're doing is right. Like, am I doing this right? Did I do it right? To the point that you're just saying, yes, 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 okay, assuming they are, of course. Then extreme orderliness with clothes or, whatever it might be, very symmetrical, the way they put things, or a belief they must pray over and over again to be forgiven for some wrong from the past, present, or future. And then believing that compulsive behavior can save a life or a disaster. Like, what are you believing if they hop a few times or if they do something that's going to save a life of somebody or stop a disaster? And the belief that our obsessive thoughts and resulting behaviors are normal and necessary to avert whatever is the fear they are trying to eliminate. So if you have that condition as an adult, obviously devastating. But imagine if you're a child and you really don't understand it at all. An additional concern is that anxiety, depression, insomnia, eating disorders, and even suicide ideation can be side effects resulting from OCD. So you not only have the obsessive-compulsive disorder, but it can really bring on other psychological conditions. So what do you do, Mike? I mean, if you have this, if you're a child who has this, well, these are some suggestions on how to help your child. First of all, do not just believe it's a mental health condition your child's going to grow out of. Okay, don't just believe that, because it doesn't really work that way. Often, the person will get worse. Not that it can't get over it, obviously, but it can get worse and worse and worse. So you really want to be dealing with it early on. If you can't seem to deal with it at home, then you really want to seek out an experienced therapist in treating OCD. Then cognitive behavior therapy, CBT, in the form of exposure and response prevention, ERP it's called, is considered the gold standard for mental health treatment. And this is where you, in a neutral type of a setting, you try to expose the person to the fear and then try to work with them you try to work with them without dealing with the compulsions. And this can be very, very difficult, I might add. And so if you've ever known anybody with OCD, and it's not just perfectionism. We're talking about to an extreme. Another thing to do is talk to your family physician or pediatrician, discuss possible medication. There are medications such as the SSRIs. These are the serotonin reuptake inhibitors. We tend to think of the Prozacs of the world. We tend to think of these are the kind of typical medications. They have been found to be helpful with children. They're generally not used unless it's moderate to severe. And then family counseling can really be helpful too, where everybody kind of works together to help the person overcome the condition. And parents really, in a sensitive manner, need to help their children realize OCD is a mental health condition that needs to be eliminated as much as possible. And children cannot be allowed to believe that behavior is normal because it can really overwhelm someone. So if you have a child who has this condition and you see it really having some negative impact, you just can't just go along with it. You really do have to intervene in a good way and really be able to help the child overcome it. Otherwise, it can be pretty devastating. And the thing about obsessions and compulsions, people often pick up more of them over time. So you really have to find a way to eliminate them as much as you can, because it can lead to a really difficult time. It can take a lot of your time. I mean, it can take an hour or two of your day just doing all this thinking. So we really don't want our children to be going through that. And this is something I talk to parents to on the phone. We talk and just see this condition. So tough thing to overcome if you have it at any age, let alone if you're a child or adolescent.
Yeah. You mentioned that it can change over time. Like they gain, maybe they give up one obsession, compulsion, and then they pick up a different one.
That's right. That's right.
I have found now I'm going to tell you, this may shock you, but I have a lot of little quirks that I have to do. But I'm not a hand washing guy or anything like that. But I remember as a kid, my bedroom was upstairs. When I came down every day, there was this overhang that the paneling, I had to put my hand up on it and put this seam that was in the paneling. It had to intersect with my hand a certain way, so much so that it wore a hole in the wall. All right, every day, and but that gave that up. That went away eventually. Now I'm sure other stuff may have taken over it, like cookies. I don't know, but I don't think it's inhibited me at all in my life. In fact, I would think in some ways, I mean, my little quirks, I don't know, they sort of have played into in a positive way, and sometimes I think you and I, if we ever had a private discussion.
Well, I think what you'll find, Mike, let's call it quirk, it's only when it really impacts you negatively in life. I mean, if that's something you did and it didn't negatively impact you and you just felt doing it was okay and you got over it, then that's not a problem. But if it got to the point that if you didn't do it, then your day would be ruined. You would be thinking about it all the time. Like, by not doing it, it disordered your world. It disordered things. Then it becomes a real negative thing. These are the people that they'll be out outside and they'll say, "God, I locked the door," and they'll keep going outside. Or with kids, they will keep coming up to you and saying, "Did I get this right?" And you'll say, we've done this 5 times already. Yes, you did get it right, but I have to know. I'm not sure. Somehow I think I did something wrong. Are you sure you have this right? Or when someone thinks that an evil is something's really going to happen, like someone's going to die unless they say a certain number of prayers, or unless they do something that may not even seem to the least bit related to it, but they believe if they don't hop through a room, hop into it, hop out of it 20 times, that something really bad is going to happen. And these are things that sometimes you don't really notice, that there can be people that every 10, 15 seconds they put their hand through their hair, or they clench their hand. You don't really know, because a lot of times these can be hidden, but if you tell the person, well, that's nonsense, or don't do that, they can really get upset because they really believe this is critical.
Right, and that brings me to, if you're a parent, you don't want to, I'm just guessing you're the pro here, but you probably don't want to go like, "Listen, Junior, would you just stop it? That's really a stupid thing you're doing."
Well, yes. I mean, I agree with you. First of all, that's not a good technique unless it's something pretty dangerous or something. But no, you really want to talk to the person and let them really know that this is a bad condition, and it's the type of condition that can really lead to more and more problems for them. And it's not a normal, average type thing. This is a key. See, what happens when people are young, they don't know. They'll say, like, if I don't hold my breath for this period, then
Ooh.
I will be punished or something bad will happen to my family. And they really believe these things. They start creating these obsessions and compulsions. And unless they do the compulsion, they really get anxious and they get upset and they get worried and so it's really the need to really show them this is where you can be with them and say, look, if you don't do this, you don't do this compulsion, this isn't going to occur what you think. Like, no, nothing's going to happen to mommy or daddy or something, this type thing. And it can be very difficult because they don't believe it. So it's something to work on. And this is where there are times you do need a therapist, you need family working together. But you're right, it isn't like, Junior, stop doing that, you're an idiot, that's a dumb thing to do, because that's not how most people respond. But not all people really don't respond well to being attacked. Okay, but it's a more common thing than you might think, and it's something people don't talk about because, parents, kids they realize that how people might see it, but they think it's normal for them because it's how they behave, and they don't realize that it's something they have to overcome. But it is a problem if you have a child that have it. Boy, it can be very difficult for everybody, particularly when it manifests itself with pretty extreme type of OCD type behaviors.
Dr. John Braccio, OCD. Wow, 1320 WILS.